As freshman congressmen wrapped up their orientation, we caught up with the newest physician in Congress, Dr. Raul Ruiz. An emergency physician and Democrat from the Coachella Valley in California, Dr. Ruiz told us it's the disparities in his region that inspired him to swap his white coat for an office on the Hill.
What really inspired me to run for office was to see the great disparities that we have, not only in income, job opportunities, health and healthcare, but also education. And I understand the importance of wellness in the community, and we have to address those social determinants of health that's going to improve the lives of the people that we serve, and especially our patients. And my father always told me never to complain unless I was going to be part of the solution. So I put my hat in the ring, and here I am.
Dr. Ruiz said one of his main concerns is boosting the physician workforce.
We have a crisis not only in the magnitude of people not being able to afford any health care, but also in the lack of services with one of the largest physician shortage crises in the state. For example, in the underserved areas, we have one doctor per 9,000 residents, where the medically appropriate recommendation is 1 to 2,000. And we have communities that have 40% of households living with a median household income below the federal poverty level. So not only can they not afford it, but there's not a physician around for them to afford it. So we have to increase the amount of physicians. We have to distribute them in places that are medically underserved, and hopefully primary care and prevention services, so that they don't utilize emergency medical services and come to see folks like me. I'm an emergency medicine doctor, so that we can keep them out of the emergency departments and healthy in their communities as much as possible.
Like many of his Republican physician counterparts, Dr. Ruiz said he's concerned about reforming the physician reimbursement model and ensuring physician involvement in any cost-cutting decisions in healthcare.
We definitely have to upgrade or create a new SDR physician payment system. The current one is antiquated. It hasn't matched the rate of inflation, and we have to create these incentives that are going to prioritize the health of the patient and the community wellness. Right now we have a lot of incentive to do procedures and other expensive modalities of treatments. But what we should incentivize is prevention, is health, and really value our primary care physician workforce, because right now we don't have enough, and we need more to practice in the underserved, medically underserved communities. As physicians, we need to come together and become organized and have a voice at the table, so that the decisions are not purely made by statisticians or bureaucrats or folks that are looking out for others' political will, but as physicians, we need to look out for our patients.
While many of his colleagues in the House look to repeal the health care law, Dr. Ruiz says he wants to make sure some provisions stay in place and that there's enough physicians to support them.
There are some very good provisions in the Affordable Care Act that we cannot let slip by. For example, we should definitely keep the protections that patients have from insurance companies discriminating against them with who have pre-existing health conditions. We should continue to allow our students and our youth to remain in their parents' health insurance until the age of 26, continue to eliminate the disparities for women in purchasing premiums and the cost of premiums because they're women, and those other patient protections that we have. But we have to go beyond that, and we have to now make sure that on the other side, the supply side of the healthcare market, is going to be able to meet the needs. You can insure millions more people, like the Affordable Care Act will do, and we desperately need to do that. but if we don't have the physician workforce prepared or enough to match that need, then we're going to create even a more overburdened system and overcrowding, for example, in the emergency departments, because now people will have health insurance and go to the emergency departments when they can't reach their primary care doctor. So we need to focus on primary care physicians, and family physicians are a key element in this, and we need to also incentivize more people to practice family medicine, especially in underserved areas where the disparities in care are greatest.
As one of the few physician Democrats in Congress, Dr. Ruiz says he offers a unique perspective to the healthcare debate.
I'm an emergency medicine physician. I grew up in the Coachella Valley in Southern California. My parents were farm workers. I grew up with humble beginnings. I lived in a trailer the first few years of my life. My older brother was the first to graduate from high school, and there have been angels in my life, like my high school counselor who paid for my college application, that allowed me to proceed. So I have an experience of growing up in an underserved community, and my dream was always to become a physician and come back home and serve the underserved communities, and I've done that. I've been on the ground. I created some free health clinics for the uninsured. I mentor now about 150 students from underserved communities who want to be doctors. I created an initiative to develop a community-based strategy to improve healthcare access, and my personal life experience and the work that I've done in the field, on the ground, and practicing medicine, practicing emergency medicine, where we're in the front lines of primarily the uninsured and the indigent when they have no other place to go, gives me a unique perspective. A lot of the Republican physicians want to repeal the entire Affordable Care Act, and they've tried it numerous times. That's a difference of opinion there. But more importantly is we need to talk about the common ground. We need to talk about the benefits of having physicians on both sides of the aisle. We need to talk about being able to educate our colleagues and also the population about patient-centered or people-centered policies where we can measure outcome and definitely show a difference. And this is the opportunity that we have to find common ground as physicians.
With IMNG Medical Media, this is Francis Correa.